HIV infection, human immunodeficiency virus, is a retrovirus that's transmitted through blood and body fluids, most often semen and vaginal secretions. HIV targets the CD4 lymphocytes, which are also known as T cells or T lymphocytes. These T cells work in concert with B lymphocytes, and they're both part of a specific acquired or adaptive immunity. So what HIV does is it comes in and it integrates with the RNA into the host DNA through reverse transcriptase, and it reshapes the host's immune system. So it actually goes in there and changes the individual's immune system. HIV is found also in feces, urine, tears, saliva, cerebrospinal fluid, cervical cells, lymph nodes, corneal tissue, and brain tissue. But epidemiologic studies have shown that these are unlikely sources of infection. Infection is usually transmitted through blood and body fluids. Any woman who is pregnant should be screened for HIV, and HIV infection is a continuous disease that has actual 3 stages. The primary HIV-1 infection occurs, and so once the infection has occurred, manifestations occur probably about between 2 to 4 weeks after infection. And the symptoms are those like a flu, like influenza. So they have flu-like symptoms, and also be a persistent lymphadenopathy throughout the entire disease process. The second phase or stage is a chronic asymptomatic infection, and this can be very prolonged, and it is clinically silent or asymptomatic. The client remains this way for 10 years or more, and the client is making anti-HIV antibodies, but they're still HIV positive, which makes them HIV positive, right? So over time, the virus within the individual begins its active replication using that altered genetic machinery that occurred when the reverse transcriptase took place. So then we see it destroys CD4 cells, we see another increase in the viral load, and a dramatic loss of immunity. The last stage is AIDS itself, and this is characterized by a life-threatening opportunistic infection. So typically what happens is individuals who are HIV positive flip into AIDS, and then it's an opportunistic infection that actually leads to their demise. This is actually the end stage of the HIV infection. And without treatment, death occurs usually in 3 to 5 years. All people with AIDS have HIV, but not all people with HIV have AIDS. So they can be HIV positive, but they have not yet converted to AIDS. So it's important for us as healthcare professionals to teach individuals how the virus is transmitted and ways to prevent the infection. We want to encourage individuals to maintain up-to-date immunizations, as well as a yearly seasonal influenza and pneumovax. Risk factors primarily are unprotected sex, vaginal, anal, and oral, multiple sex partners, occupational exposure, and that would cover us as healthcare workers. We have a risk of needle sticks, so that makes us at risk. Perinatal exposure, and that's the fetus risk through the mother. Blood transfusions. It's not a significant source of infection in the USA now because we really screen blood. And then IV drug abuse or drug use with a contaminated needle. And the HIV infection can actually go undiagnosed in our elderly population due to the similarity of its symptoms to other illnesses that are common in that age group. So older adults are more susceptible to fluid and electrolyte imbalances, malnutrition, skin alterations, and wasting syndrome, which is also seen in HIV. And older women are following menopause, they experience vaginal dryness and thinning of the vaginal wall, which increases their susceptibility to the HIV infection. So women are more at risk because they have more mucous membrane, and there's like more mucous membrane in the vagina than in the penis, so women are at higher risk. So what kind of signs and symptoms will we see? We'll see chills, anorexia, nausea, weight loss, weakness, fatigue, headache. Sounds like the flu, doesn't it? Night sweats are also seen. So how do we diagnose this? We have some lab criteria. A confirmed case classification meets lab criteria for diagnosis for HIV infection and either one of this or of the stages themselves. So in stage 1, we're not going to see any defining conditions. The CD4 T lymphocyte count will be 500 cells per milliequivalent per liter or more. And in stage 2, it'll be between 200 and 499, so it's lower. And in stage 3, they will have less than 200 CD4. Their CD4 count goes down. So when we go to diagnose, if you go on to the cdc.gov website, you can go and read the up-to-date information from the Center for Disease Control about HIV. So commonly we'll see a CBC and differential done. That would be abnormal. We might see anemia, thrombocytopenia, and leukopenia. The platelet count will be decreased, less than 150,000. And also, to determine HIV, they're going to have a positive result from an HIV antibody screening, which is a reactive enzyme immunoassay, or EIA. And that's confirmed by a positive result from another antibody test. So they don't do one, they do 2 different ones. And that's commonly the Western blot or an indirect immunofluorescence assay test. So 2 positives, and then they want a positive result or report of a detectable quantity from any of the following virologic tests. So it would be like an HIV nucleic, which is a DNA or RNA detection test, HIV P24 antigen test, and that also includes a neutralization assay, or an HIV isolation viral culture. So that's what they're looking at to get a positive. They're also going to look at the liver profile, biopsies. They're going to test stool for parasites. We want to make sure that we inform our patients about that. What to expect for those kind of things. And then they may do scans looking at the brain or lung to detect any abnormalities. And they're just looking for any opportunistics that have occurred there. So care of individuals who are HIV positive or who have converted to the AIDS virus. We're going to assess their risk factors, their sexual practices, their IV drug use. We're going to monitor fluid intake and urine output, get daily weights because we want to see about weight loss. We're going to look at their nutrition intake, watch electrolytes. We're going to assess their skin integrity for any rashes, open areas, bruising, and treat that. Assess for pain, and if there is pain, treat that. Monitor their vital signs, especially temperatures. They are at risk for infection, and that would be a sign for us. We'll listen to their lungs, respiratory status. As they go down the disease process, they are at great risk for a pneumonia. We're going to assess their neurologic status for any confusion, dementia, any visual changes. And we're going to encourage them to have rest periods, alternating with activity, any oxygen. We'll get that if it's needed. And I said before, take care of their skin and pain with interventions. Medications. The heart, therapy, which is highly active antiretroviral therapy. It uses 3 or 4 HIV medications in a combo setting with other antiretroviral medications, and it helps to reduce medication resistance, adverse side effects, and doses. So use a heart routine. In the heart drugs, we see entry and fusion inhibitors such as Fusion. These are given subcutaneously, so we need to make sure to rotate their sites and teach them to do that. This drug helps to decrease the amount of the virus in the body and to limit its spread. Nucleoside reverse transcriptase inhibitors, which is NRTIs. Retrovir is an example of one, and that interferes with the virus's ability to convert RNA to DNA. The non-nucleoside reverse transcriptase inhibitors, that's the NNRTIs, Rescriptor and Sustiva, they inhibit the viral replication to have the virus to replicate within the cell. Protease inhibitors, Agenerase, Virusept, Crixivan, Inverase. These inhibit an enzyme needed for the virus to replicate. So all of these drugs are working on different little bits of replication of the virus. And then anti-neoplastic medications like interleukin interferon is the other name for it. It's an immunostimulant that enhances the immune response and reduces the production of cancer cells. It's commonly used with Kaposi sarcoma if the individual has that. So as nurses, we're going to keep an eye on their blood work, CBC, WBCs, liver function tests, because all these medications really affect the liver, so we're going to pay particular attention to their liver function tests, their ALT, AST, their HDLs, as well as the triglycerides and the cholesterol. A lot of education has to happen with these individuals, so we need to make sure they understand their meds. In order to support an individual who is HIV positive or has AIDS, we have a lot of interdisciplinary care. Infectious disease services are definitely consulted to manage the HIV. Respiratory will definitely be on board to help with the respiratory status. Nutritional services to support their nutrients, and then rehab can be in there for strengthening and improving their energy level. Alternative treatments, vitamins, herbal products, shark cartilage may help alleviate the symptoms of HIV. You want to make sure you know what herbal products your patient's on, because some of these can alter the effects of prescribed meds. So make sure we understand what they're on. After discharge, we can refer them to support groups if appropriate. They may need home health support for strengthening and assistance with ADLs. Maybe they need assistance with IVs, dressing changes, TPN, that kind of thing. O2, if they need O2, we'll need respiratory at home. Long-term care facilities could be indicated with a chronic HIV or an AIDS patient. Hospice services may be required for late stages. We want to make sure that our our clients understand that they need to practice very good hygiene, frequent hand hygiene to reduce the risk of infection. Like all our immunosuppressed patients, we want them to avoid crowded areas. We want them to take caution or maybe not travel into countries with poor sanitation. Encourage them to avoid raw foods such as vegetables and meats, and instruct them to avoid pet litter boxes. Don't clean the cat box because of toxoplasmosis. Don't play on the beach, that kind of thing. We want them to keep their home environment clean to avoid their family being exposed to their family who have colds or viruses. We want to make sure they understand about transmission, infection control, safe sex, the importance of maintaining a well-balanced diet, how to take their meds, the potential side effects of their meds, what signs and symptoms they need to report immediately. Infection's a big one. That they need to adhere to the antiretroviral dosing schedules. We need to talk to them about follow-up monitoring their CD4 and viral load counts. They need to pay attention to that. The use of constructive coping mechanisms. Constructive ones. I'd help them identify primary support systems and to report any signs of infections immediately. The complications are opportunistic, really. Bacterial diseases like TB, bacterial pneumonia, septicemia. There's HIV-associated malignancies like Kaposi's sarcoma, lymphoma, squamous cell carcinoma. Viral diseases, CMV, cytomegalovirus, herpes simplex, herpes zoster virus. There's fungal diseases, candidiasis, cryptococcosis, protozoal diseases, toxoplasmosis, like I mentioned before. There's cryptosporidosis. So we want to make sure that these individuals are taking their antiretroviral medications, that we administer antineoplastics, antibiotics, analgesics, antifungals, antidiarrheals as needed and as prescribed. We may be giving them an appetite stimulant to enhance their nutrition. We're going to look for their skin, treat any breakdown, maintain their fluid intake. They are at risk for dehydration, maintain their nutrition, make sure they avoid raw fruits and vegetables. And with wasting syndrome, they may need nutrition orally or by TPN. They'll need in between supplemental snacks that have a high protein value like Boost. And then fluid and electrolyte imbalance is at risk. So we're going to report any abnormal lab data promptly, make sure they're hydrated. And then HIV encephalopathy or seizures. If a patient has a seizure, obviously we're going to be maintaining seizure precautions, and client safety is foremost.